This is a move that Tom Bowen used to call hit the lat, which is rather a strange phrase, but what it means is you're moving over the vastus lateralis, which comes down here into the outside of the knee. And as it comes down, it forms a tendon. So this is one of the Bowen moves that we do on tendons. And we will purposely do these quite a bit slower because we're really affecting different kind of receptors in these tendons, the Golgi receptors, which, as I said before, have a big effect on proprioception and our relationship to gravity. So to find this, we're going to see what the motility what the mobility is like in his kneecap. So if I imagine that the patella here has 4 corners, that's the top, that's the bottom, and I just push down towards his feet and up, I can feel what the mobility is like. Now basically where I want to move is where this outside thumb is, where it comes in towards the patella. So I'm going to use both thumbs. My lower thumb is in contact with the patella. My upper thumb is right on that tendon, and we're going to take the slack down very gently, going in, and now I'm going to challenge. So we're doing this very slowly, and all I'm doing is raising my wrists, keeping the pressure on it, and at some point we'll feel that tendon roll under my thumbs. There. So the key to that is to keep the pressure on, and as we come up, nice and slowly, keeping the pressure on and waiting until the tendon rolls under my thumbs. And now going to the other side, to his right side, which is the side that he has the issue on, so I'll be a little bit more gentle on this side. So now we're going to work on his right side, and this is the issue that he has his problems with, so we're going to be a bit more gentle on this side. So again, feeling for the mobility in the patella, that's the top, that's the bottom. Just going to see if I push down a little bit towards his foot, what the mobility is like. That can give us an indication of how much tension there might be there in the quads. So with that position, where that lateral thumb is where I'm going to do the move. So I'm going to have my thumb right over the tendon, very close and touching the patella with that thumb. The other thumb is right on the tendon, so I'm just going to take the slack down very gently, go in underneath the tendon, and then slowly, slowly raise my thumbs, but keeping the pressure on. So it's a combination of the thumb movement and the wrist movement, keeping that pressure on until the tendon rolls under my thumbs, which has just gone there.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.